Guaphan DM Syrup. Contain to active ingredients. 1. Guaifenesin. 2. Dextromethorphan. Guaifenesin is an expectorant. It helps loosen congestion in your chest and throat, making it easier to cough out through your mouth. These medicines are not known to elevate blood pressure. Dextromethorphan is in a class of medications called antitussives. It works by decreasing activity in the part of the brain that causes coughing. 100 milliliters. Now uses of Guaphan DM Syrup. Uses. Indication or uses of Guaphan DM Syrup. Guaphan DM Syrup is used to treat cough that contains mucus productive cough. Difference between dry and productive cough. A dry cough does not produce any mucus or phlegm. A chesty cough, productive or wet cough, is one that produces mucus and may cause feelings of congestion in the chest. How to use Guaphan DM Syrup. Adults, the elderly and children over 12 years. Take 10 milliliters up to 4 times daily, as required. Children under 12 years. Do not use. Important note: do not exceed the stated dose, no more than. For doses should be taken in any 24 hours. Side effects of Guaphan DM Syrup. Side effects with dextromethorphan, hydrobromide, and guaifenesin are rare. However, susceptible individuals may experience unwanted side effects. If any of the side effects get serious or you experience any other side effects, stop taking this medicine immediately and consult your doctor. Some common side effects of Guaphan DM Syrup is given below. Number 1. Allergic reactions. Symptoms could include itchy skin or rashes, difficulty in breathing, faster heart rate, swelling of the face or the throat. Other common side effects of Guaphan DM Syrup include stomach upset, feeling sick, nausea or being sick, vomiting, dizziness, drowsiness, mental confusion. Do not take Guaphan DM Syrup if you are allergic, hypersensitive to guaifenesin, dextromethorphan, hydrobromide, or any of the other ingredients of this medicine. 2. You are currently taking a prescription monoamine oxidase inhibitor MAOI, used to treat depression and Parkinson's disease, or have taken this medicine in the last 14 days. You are currently taking a selective serotonin reuptake inhibitor SRI, used to treat depression and anxiety, or have taken this medicine in the last 14 days. You have had a cough for a long time, or if you have asthma or suffer from serious asthma attacks, or if your cough is accompanied by a fever, rash, or persistent headache. 5. You have liver problems. Guaphan DM and other medicines interactions. 1. Quinidine or amiodarone or any other medicines which are used to treat heart conditions. 2. Terbinafine, used to treat fungal infections. 3. Cinacalcet, used to treat an overactive parathyroid gland. 4. Methadone, used for severe pain. Guaphan DM Syrup use in pregnancy. Please talk to your doctor before taking this medicine if you are pregnant or breastfeeding. Guaifenesin pregnancy category AC. Dextromethorphan pregnancy category AUA. Effect on hypertensive patient. Guaphan DM has no effect on hypertensive patient. Effect on diabetic patient. If you have been told by your doctor that you have an intolerance to some sugars, contact your doctor before taking this medicine as it contains sorbitol. Thanks for watching.